2010 meeting of Human Services Committee will come to order. The clerk will call the roll, please.
Ms. Andrews is excused. Mr. Daniele? Here. Ms. Cayley? Here. Mr. Lightfoot? Dr. Quattro? Here. Mr. Rocco? Here. Chairwoman Draw?
Here. Is there anyone signed up? I believe we do have speakers tonight for public forum.
We have 10 public forum speakers signed up this evening. I will call 3 names at a time. Please come forward and address the committee when your name is called. You will have 2 minutes and only 2 minutes to address the committee with your remarks. We ask that you conclude when the timer sounds. Our first 3 speakers will be Sue Gardner-Smith, to be followed by Lysel Schwartz, to be followed by J.B. Hoffa Mannon. Please come forward.
In Monroe County, the Brighton Farmers Market and the South Wedge Farmers Market in the city. Both markets are strongly committed to supporting local farmers, other local businesses, and to bringing local fresh food to the residents of our communities. Both markets are good markets. We are trying very hard to make them better markets. We know that being able to offer a sandwich or a burrito or some pancakes with fresh local maple syrup brings people into the markets, and we're trying to increase the attendance at our markets to benefit both the residents of our communities and also the vendors and the farmers who participate in these markets. Being able to offer cooking demonstrations at the market where people can sample food prepared right there educates people, and it also stimulates sales to the vendors and the farmers at the market. The current health department fees are prohibitively expensive for the vendors, for people to come and sell food right there at the market. They were put in place before the farmers markets became as popular and as powerful and as important to communities as they are now, and they're applicable to fairs and festivals, but not so much to farmers markets. We would appreciate having the fees changed to reflect the specific needs of farmers markets. We'd like to be able to offer food. It would allow us to bring in restaurants, other businesses, and it would be a great benefit for us. It would help us to create better markets, stronger markets. Thank you.
Thank you.
Hello, my name is Liesl Schwartz, and I'm a student at the University of Rochester. And as a student, I know how important it is and how wonderful it is to have a fresh, prepared meal off campus every now and again. And it's really great to see that and get that at a farmer's market. Farmers markets also give us a sense of community in our neighboring areas, which we don't necessarily get at other locations. It was a disappointment for many students to see these prepared foods taken away, and as a result, our population at these markets has decreased. It's a great loss for both the markets and the city of Rochester because these markets show how great of a community Rochester really is. We really hope that you bring back these, we really hope that markets are able to bring back these prepared foods, as increasing Rochester community will help decrease the brain drain. Thank you.
Thank you.
I promise to speak under 2 minutes. Okay. My name is J.B. Afomanin. I'm currently the president of the 19th Ward Community Association. In that capacity, I represent over 22,000 people in the city of Rochester. My goal in writing, I wrote this email to some of the committee members today. My goal in writing this to you today is to urge you to support the proposed legislation of Willie J. Lightfoot Jr., which would reduce the cost to area vendors who plan to participate in the seasonal farmer market season throughout Monroe County. The cost as it stands is prohibitive for sustained participation. This issue is neither a Democrat nor a Republican issue. It is a human issue. As an avid consumer and supporter of farmers markets, I ask you to vote the proposed legislation out of committee so the entire legislature can vote on the need to reduce the onerous cost to vendors who want to provide healthy living options to Monroe County. In addition to my prepared statements, as the president of the 19th Ward, we actually organized a couple of events to focus on holistic health. One of those is our annual 5K run walk, our second annual one coming up this year, actually. Last year, we had about 250 runners and walkers, respectively, who came out to the 19th Ward. This year, we hope to at least double that. One of my focuses within the 19th Ward is to focus on holistic health, and the farmers market is being one of those. The more options we have for folks who can come out on a weekly basis, the better, the more participation. There's been great success in farmers markets throughout the entire county of Monroe, whether it's Brighton, whether it's South Wedge. We want to help substantiate that right here in the 19th Ward, Sector 4 specifically. So we encourage you guys to do the right thing and really help to make the option for vendors not so onerous so that they can participate on a week in and week out basis and not be forced to not come out. Thank you very much for your time.
Thank you.
Our next three speakers will be Michael Warren Thomas, to be followed by John Curran, to be followed by Jackie Woodward. Please come forward.
Thank you very much. Michael Warren Thomas, avid food lover in Rochester. And there is a sense of urgency to this. Unfortunately, I guess this won't actually be voted on perhaps till May at the absolute earliest at this point, which gives the potential food vendors at our markets less than a month to prepare staff and to think about participating in these markets once again. So at best, if this comes up for debate in April and you vote in May, they will have a few weeks to get ready. If there's a way to actually move this through, because it really is a bureaucratic issue, as JB said, it's not Democrat versus Republican. It's an issue of the current regulations are designed for festivals that run for a few days or a week. They're not designed for farmers markets that run for 6 months or 5 months. And so the fee would be over $1,200 for a year for a restaurant to come to a farmer's market versus $150 as we're proposing. If there's a way to move this forward tonight so that it can be voted on in April, then they get an extra month to get ready. It's about, the county legislature has supported Grow Monroe. This is a part of that, getting more people to buy more local food and encouraging more local business. So there is a sense of urgency to this, both from the market's survival as well as the local businesses. Thank you.
Thank you.
Hello, my name is John Curran. I'm a member of St. Monica Parish. St. Monica Parish is the host for the West Side Farmers Market on Genesee Street. In Southwest Rochester, we lack a comprehensive food supermarket that's nearby. What we do have are the small corner stores. There was a poll done last year by students from the University of Rochester with regards to the small stores that do sell food, the corner store, the mom and pop store. Of the approximately 70 stores in the Southwest Rochester area, only 3% carried fresh fruits, fresh vegetables, and fresh milk. Our farmers market meets a critical need in our neighborhood to get the fresh foods that we need. As you know, we have the obesity epidemic. We have persons with diabetes who are just not getting adequate, proper foods. It was a heartbreaking thing to learn that it is not a matter of importance that we have a food market on the west side. It must be appreciated that we have had a loss of our consumer support because we have lost the ability to have the fresh foods prepared by our vendors there. The quality of life for the market suffers when you don't have that chance for a meal, the chance to share. And when we lose our market support, then our market itself becomes vulnerable. So we ask that you realize that this is a matter of importance, and please do act soon to be able to address this. Thank you.
Thank you.
My name is Jackie Woodward, and I'm with the Westside Farmers Market, and I also work at NeighborWorks Rochester. As someone who used to work in a locally owned restaurant, I know how difficult it can be to stay in business during these times when people aren't going out to eat as much. But during our market season, everyone gets really excited about having prepared foods, coming home from work and purchasing food and purchasing their vegetables for the week and eating together. We sit under a table and talk about what's going on in our community. what's happening. My mother and my grandmother actually played Scrabble under the table, which was kind of cute. And it's the best opportunity we can offer our local restaurants to support them and give them an opportunity to thrive. So please show your support for these restaurants, as well as our farmers market, to make it fiscally possible for these vendors to continue to showcase their delicious cuisine at our market. So please push it on your agenda. Thank you.
Thank you.
Our next three speakers are Jackie Farrell, to be followed by Eleanor Coleman, to be followed by Jessica Coleman. Please come forward.
Committee members, I'm Jackie Farrell. I manage the West Side Market. For the 2009 season at the market, we encouraged catering restaurants to sell hot and cold, nutritionally balanced foods every Tuesday evening. They met with great success. Shoppers came, bought dinner and fresh food items. We soon learned that the caterers needed to apply bi-weekly and to pay a fee in addition of $115 each time, in addition to their license permits that they were already paying. The fee wasn't affordable to them, and it was also not affordable to our market. We asked them to stop coming until we learned more. They unfortunately were not able to come again the rest of the season, the remainder of the season. When the food vendors left, many of our shoppers left. I heard complaints weekly from folks who wanted to buy dinner at the market. At our market, we track the number of shoppers, and we keep an attendance list of vendors. Our numbers went down significantly. And I hope I'm not right that I figured it was a percentage of 42, because I can't believe it went down 42%, but that's what I figured. So to get to my point, when dinner food is available at the market, it attracts additional shoppers. People look forward to coming to the market, buying their dinner, sitting at a picnic table, socializing with old friends, and meeting their neighbors. In addition to eating dinner, they shop at the booths of other vendors, buying fresh, local, and healthy produce, meat, and bread. It is a win-win situation for everyone, with crucial benefits for the entire community, including a diet of healthy food. Neighbors get to know each other, shoppers support the local vendors, and vendors continue to invest in our neighborhood. It is how we build community and how we encourage our community to thrive and grow. I encourage you to adopt this amendment with speed, help us grow our markets, and help us build our communities. Thank you.
Good evening. My name is Eleanor Coleman. I'm the Director of Youth and Family Services at the Southwest Area Neighborhood Association. We are the lead agency for the community center that's attached to Wilson Foundation Academy, about 1,000 7th, 8th, and 9th graders. We also have an after-school program for ages 6 to 15, from 2 to 6 every day, in a summer camp. As part of our curriculum, we have created a greenhouse, so we believe in Grow Monroe. And we also look at the whole county. We'll be going actually to Batavia for learning about curriculum in the greenhouse. The greenhouse is a way for kids to learn how to grow produce, sell it. They sell it at the Westside Farmers Market. That's their venue. And it's a really great opportunity for them to get to work alongside of other vendors and get job readiness skills and learn about healthy eating. We're trying to change a culture, and for us, that the importance of community building is built into that. We're trying to get adults out there. The only market we have, or the food store we have, is on West Avenue, way out West Avenue. Genesee Street is really a much better bus line. It's also, I live on one end of Genesee for over 30 years, and I work on the other end of Genesee. It's a hoppin' place, and it's a really centralized location for the whole Southwest in being able to obtain fresh fruits and vegetables. The other piece about our constituency is we learn by seeing, project-based learning, by touching and doing. And so this issue with obesity and diabetes, they need to actually be able to see that, how those foods are prepared. Thank you very much.
Thank you.
Our last speaker is Robert Boyd.
Hi, my name is Jessica Coleman. I am a lifelong Southwest Rochester City resident. I am a district delegate for the 19th Ward Community Association, and I'm actually a recently hired nutrition educator with the Cornell Cooperative Extension. I can't say in my 1 week of experience in that job that I know everything about nutrition, but I have had the opportunity to speak just today. I was speaking with a table of about 20 experienced educators, and one thing that they were discussing was how we deal with a lot of low-income persons, and people on low budgets feel that they can't afford to eat healthy. They can't afford to buy fresh fruits. It's more expensive to buy fresh foods than it is to buy things that are pre-prepared. So there's a lot of shopping at Walmart and trying to buy things that are really inexpensive, which are much worse for their health. Going to markets like the Southwest, I can speak in experience from the Southwest or the West Side Market. The foods are not expensive. You can, to get fresh fruit, fresh vegetables, it costs a lot less than going to the grocery stores, and it's a lot closer for a lot of people who don't have vehicles, who don't have the means to get to, certain places. We only have a Tops. We don't have our Wegmans anymore. So it is very difficult for some people. In my experience in attending the West Side Market, I know I saw the extreme drop in attendance when foods weren't prepared. If you think about the time of day that these markets are held, they're held during the week, so we can't hold them, during the day. People come right after they leave work, and it's a big draw to have prepared foods there. Also, just speaking on behalf of the vendors that we have with the prepared foods, they're not huge. They're not franchises. They're not huge businesses. They are homegrown, and it's very difficult to afford to be able to pay such high fees. So as has been said before, please expedite this as best you can so that they have the ability. Thank you.
Thank you.
My name is Robert Boyd. I'm the Executive Director of the South Wedge Planning Committee and the South Wedge Farmers Market. The South Wedge Farmers Market provides access to fresh local fruits and vegetables to the residents of the South Wedge. It also provides an additional source of higher profit retail business for small farmers and vendors. The market approach to bringing together consumer and producer leads to healthier eating, which leads to improved health and sustainability of small firms. Over 100 small businesses come and participate in our markets in Monroe County, selling their products. This proposal will create jobs for Monroe County residents. In Monroe County, over 5,000 residents in season come to markets stretching from the South Wedge to the City Market, to Chili, to Fairport, to Scottsville. And many of you have been at all of these markets and have participated in them. We have been working with residents on healthy eating for some time now, and the greatest obstacle that we find is the consumption of processed foods, primarily fast foods, that are extremely high in fat and calories. We'd like to teach people that prepared foods can be healthy and convenient at the same time. We have a number of small businesses throughout Monroe County that do produce healthy prepared foods. We'd like to expose residents, those 5,000 people who come every week to the market, to more healthy eating. The current rule requires a permit that costs $115 every 2 weeks, which is $1,265. It isn't worthwhile to do that. And for those of you that have your own small business, you know that some of these fees can get in the way of whether you hire someone or not. Healthy eating leads to lower instances of diabetes, high blood pressure, other health issues. This will lead to lower health care costs long term, especially amongst low-income families, many of who rely on Medicaid. I hope that you believe that healthy eating is important to the long-term health of our community, and that you believe that small business is important. So we encourage you to take action on this matter sooner than later. Thank you.
Thank you.
This concludes the public forum.
The next item on the agenda is the approval of minutes. You have the February 23rd, 2010 minutes before you now. They will stand approved unless the clerk is notified by any changes by the end of today. Next item on the agenda is new business. Madam Clerk.
Referral 88, acceptance of a grant from the New York
Moved by
State.
Legislator Rocco, second by Legislator Quattro. Any questions? Legislator Cayley.
Thank you. Through the chair, this is a new grant. Can you, well, first of all, it speaks to collaborations with other counties. Can we find out what counties we might be collaborating with, or what counties may already be doing this? Is this new all the way around, or just new to us?
Through the chair, this is Cindy Lewis, Director of Children and Family Services for DHS. Yes, this is a new grant. The State of New York, OCFS, developed an initiative around disproportionate minority representation that they made available to 5 counties in New York State. That would be Erie County, Monroe, Nassau, Suffolk, and Westchester counties.
And then through the chair, what is this a collaboration of all those counties, or would we be collaborating with 1 or 2?
Through the chair, it is a collaboration only in the sense that there are some joint conference calls, some discussion cross-county, but each county is to develop its own plan. We had a forum yesterday with Erie County, together with Erie, primarily because we're the 2 upstate counties, to discuss the beginning of this. But the primary focus of this grant, it's a 1-year planning grant that's designed to do 3 things. First of all, to help us analyze our local DMR data and get a better understanding of what it means to us here in this community. Secondly, to learn some things from Casey Family Programs and the Center for the Study of Social Policy about what approaches have been effective in other parts of the country to address this issue, and then lastly, to help us develop a local strategy that we can implement going forward.
One last question. So if I understood you, this is a one-time grant?
Through the chair, at this point, yes. They have said they are hoping that it may be able to be extended, but at this moment, it's 1 year, yes.
Thank you.
Any other discussion? Legislator Lightfoot.
Madam Chairman, I would like to ask that, I've noticed that this is done, it seems to be the analysis and a lot of the data collection seems to be done by zip code through you, Madam Chairman. I would just like to ask that a report, when finalized, be given to this body at some point in time, because I'm sure a lot of this data that's being collected and information might be helpful as we look to in our individual districts and zip codes. Through you, Madam Chairman.
Through the chair, I do not have all the data yet. The data I have seen thus far is not sorted by zip code, but that's not to say that we won't get it, and we'd certainly be able to provide what data we get.
Thank you.
Seeing no other discussion, all those in favor, please say aye. Opposed, none? Motion carries.
Referral number 1089,
Moved
authorized.
by Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Lightfoot.
Through you, Madam Chairman, glad to see that the Catholic Diocese are providing these services. I think that that's great, especially for the people there. However, I'm asking, are other faiths going to be represented, or is it just the Catholic family religious services? Through you, Madam Chairman.
Good evening. I'm Todd Spring, Executive Health Director of Monroe Community Hospital. Through the chair, this particular contract is only with the Catholic Diocese. However, we do make arrangements. In fact, we're obligated by public health law to accommodate the spiritual needs of all of our residents. We've got Protestant chaplains, volunteers, rabbis, imams, Jehovah's Witnesses, Mormons. So all faiths, any faith that a resident expresses interest in is represented in some way, shape, or form. But this contract is specifically with the diocese for Catholic services.
Thank you.
Discussion? Legislator Cayley.
Is this the first time that we've had a contract with the diocese? I'm sorry, through the chair.
Through the chair, I've been at MCH 10 years, so I can speak certainly that far. I suspect much longer than that. This is a renewal of a contract which has been in effect for a very long time.
Thank you.
Any other discussion? Seeing none, all those in favor, please say aye. Those opposed, no. Motion carries.
Referral number 1090,
Moved
acceptance
by
of
Legislator Daniele, second by Legislator Rocco. Any discussion on this? Legislator Rocco.
Through the chair, can we find out how many individuals, families were helped by this program last year?
Madam Chairwoman, my name is Robert Franklin. I'm the Deputy Commissioner for the Department of Human Services. For calendar year 2009, approximately 94 children were served related to this grant. The grant is a fiscal year, May to April. I gave you a calendar year number as we're currently not through this year.
Any other discussion? Oh, Legislator Cayley.
Through the chair, can you give us an idea of what the impact will be with the reduction? Am I on the right one?
Madam Chairwoman, I'm not exactly sure I understand the question. If there's a reduction to this grant, the Department of Human Services is mandated to continue performing these services.
Through the chair, let me say it this way. Right. Will there be any significant impact with the reduction of funding? Through the chair.
Madam Chairwoman, no, there will be no reduction in the services provided.
Thank you.
That's really what I asked the first time. Any other discussion?
No, that's it. Thank you.
Thank you. All those in favor, please signify by saying aye. Those opposed, no. Motion carries.
referral 1091,
Moved by
acceptance.
Legislator Rocco, second by Legislator Quattro. Any discussion? Seeing none, all those, oh, I'm sorry, Legislator Cayley, I'm sorry.
Thank you. Through the chair, can you give me just a small breakdown of what percentage actually goes for the grants versus the administration costs, or are there no administration costs?
Madam Chairwoman, out of the current referral of a little more than $552,000, we'll be applying $7,667 towards internal overhead costs, which can generally be described as administrative.
Thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. No, motion carries.
Referral number 1092, amend Resolution 30.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion on this? Legislator Cayley.
Thank you. Can you give us an idea of how the additional funding is going to be rolled into this, where it's going to fall?
Madam Chairwoman, this referral is accepting additional funding strictly for administrative costs, so this will be applied towards the salaries and benefits of our staff, as well as administrative costs associated with our alternate certifiers.
Any other discussion? Seeing none, all those in favor signify by saying aye. Those opposed, motion carries.
Referral number 1093, acceptance.
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion? Legislator Lightfoot.
To you, Madam Chairman, to the administration. First year of a grant, where's the difference of the 67,100 and we're on 93, correct? To you, Madam Chairman.
Yes, we are 93.
Yeah. Okay. What is the difference between for the first year of $67,112 going through you, Madam Chairman, to the administration?
Through you, Madam Chair, I am the Director of the Monroe County Health Department. My name is Dr. Andrew Doniger. So there are two dollar amounts in the first paragraph. Is that you're referring to?
Yes, sir.
Through you, Madam Chair, $100,000 is the total dollar amount that is coming to the county. Then $32,888 is for a contract with the University of Rochester. The difference, which I think is about $68,000, will be spent on vaccines and for some staffing costs that we have internally in the department.
Thank you.
Any other discussion? All those in favor then signify by saying aye. Any opposed? Motion carries.
Referral 10-94.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Legislator Cayley.
Thank you. Through the chair to the administration, can you just kind of describe this? This is the first time that I've seen this. What is the process of your capacity building, just for my information?
Through you, Madam Chair, obviously all of the country has been interested in preparedness against various kinds of medical emergencies, and we have identified that in many of these emergencies we may ourselves in the health department not have enough staff to be able to sponsor clinics, do all of the kinds of tasks that might be necessary. And so around the country, many communities have developed this concept of a medical reserve corps, which is basically a listing of individuals that have various kinds of medical skills that could be called on in the event of an emergency to come and participate and assist in the government's effort. So, for example, during the H1N1 immunization campaign that went on during this fall and winter, we were able to call on members of the Medical Reserve Corps from Monroe County to help us staff those clinics. So that's kind of the concept of this.
Any other discussion?
No, thank you.
Seeing none, all those in favor signify by saying aye. Any opposed? Motion carries. Next witness.
Referral 10-95.
Moved by Legislator Daniele, seconded by Legislator Rocco. Any discussion? Legislator Lightfoot.
Madam Chairman, to the administration, we have another one of those situations where there's a difference in the numbering, and I'm just trying to get a sense of, here it's about a 69,500 figure, and I'm trying to get a figure of where's that going, the difference in the amounts of the numbers listed in the referral here. This particular grant, through you, Madam Chairman.
Through you, Madam Chair, are you asking for a breakdown for how the total of $85,000 is going to be spent?
Well, there seems to be a difference here in the amount of money shown here from the $85,000 to, I believe, the other amount mentioned. So from last year, so there seems to be a difference of $69,500 of that grant monies. Will it stay in the water quality grant funding department or public health, or what will be the use?
Through you, Madam Chair. So the total dollar amount of the grant award that will be coming to the county is $85,000. And in the first paragraph, there's the mention of those two contracts. One to the Rochester Museum and Science Center for $5,000, and a second one to the Monroe County Soil and Water Conservation District for $10,500. In addition to that, approximately $30,000 will be used to purchase oxygen and tank rental for a project that the Health Department is involved in to maintain the water quality in Irondequoit Bay. $34,500 is the county's share of a cooperative agreement with the United States Geological Survey that helps us with water quality monitoring in the county. $500 for the soil and water conservation field days, and $5,000 for a study to be done by the Monroe County Stormwater Coalition on the sources of phosphorus, for a total of $85,000.
That's what I need. Thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Motion carries.
Referral 10-96 authorized.
Moved by legislator Rocco, seconded by legislator Quattro. Any discussion on this? Legislator Cayley.
Thank you. Through the chair, I just want to know that I understand this correctly. On attachment A, all of these contractors are to be receiving funds? Or did I read it wrong, incorrectly?
Through the chair, my name is Mike Deedy. I'm a division manager with the Department of Public Health. And yes, that is our current provider contract list for special children's services.
And is it possible to get a breakdown of the individual contracts? It's just the amounts that are going to each one? I'm certainly through the chair, not today.
We could look at past payments to providers. To get a breakdown is difficult because the services are needs-based for the children enrolled, and we don't have a specific number of children who will be seen by a particular vendor or provider and a set number of services. So the mandate to provide these services is really, the services may vary by child, and they may either cross over to different providers, multiple providers, or change providers at any given time.
Okay, through the chair, then you're saying that at the end of a year you could break it down?
Yes, through the chair.
Then through the chair, could we get a breakdown for 2009? Am I in the? I'm sorry, that wouldn't be the end of the fiscal year for that, through the chair, right? If you're just accepting it or not?
Through the chair, we could provide the 2009 payments.
Thank you. And one last question. Through the chair, the amount is not to exceed what's on the referral. Is there ever a time when it's not spent down? And then if there is a not spent down, then does it stay into the next fiscal year?
Through the chair, this amount was a projection based on past utilization, and if we do not achieve that amount that is listed here as not to exceed, the money does not roll over. It's not to be spent on anything else. This is a projection based on utilization of services.
Thank you.
Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. And those opposed, none. Motion carries. Are there any other matters before this committee? Seeing none, then no further business of the March 23rd meeting of the Human Services. The next meeting of Human Services is scheduled for April 27th at 6 p.m. here. Thank you.